It's just over 60 years since the first successful kidney transplant was done in Boston in 1954 between two identical twin brothers. In the early days of transplantation, most transplants were between living-related donors, and then as immunosuppression became more successful, between non-related living donors. There was a problem, however, with living donors. First, that they weren't enough to answer all the needs of people for transplanted organs. And second, because they obviously could not donate vital organs such as the heart or lungs. So that raised the issue of post-mortem or cadaver organ donation. Sadly, many Jews don't understand the Jewish attitude towards organ donation. We have three principles in dealing with people who have died. The first is that we prohibit nivul hamet, or desecration of the body. And people kind of know this from the general Jewish reluctance towards autopsy, which we frown on except in the circumstances where a particular person's life is at stake that might be saved by the autopsy. The second issue is what we call hana'ah min hamet, or deriving benefit from the dead body. And finally, halanat hamet, delaying the burial of a dead body. We know Jewishly that we prefer to bury people who have died very soon after the death. So we need to deal with the question of whether post-mortem organ donation violates any of these principles. And what most rabbis have said is that we have an overriding principle, that of piquach nefesh, saving a life. That, as well as the principle of lo ta'amod al dam rei'ekha, don't stand by while one of your fellow human beings is dying and could be saved. So these two principles, if override the issues of how we treat a person who has died, so that removing an organ for purposes of saving someone else's life is not a desecration of someone who's died, is not deriving benefit in an unacceptable way, and is not a prohibited delay of the burial. The next questions that arise in post-mortem organ donation is how we recognize that a person has died. Throughout the entire United States and in most of the rest of the world, we can assert that a person has died based either on neurological criteria, what's often called brain death, or respiratory and circulatory criteria, what is often called cardiac death. Jewishly, most authorities recognize both of these as criteria for death and permit the use of organs that are taken from people who have died by either of these two criteria. So brain death and cardiac death are both acceptable diagnoses of death, and the main disagreement among authorities is whether the act of donating an organ is a mitzvah, is a chiyuv, is obligatory, or whether it's an act of chesed, an act of piety. In either case, it is considered laudatory, it is a valuable thing to do, it is recommended that we do it, and people who do it are considered praiseworthy.